Welcome to the Lessons in ADHD online video from the makers of Concerta. The second video in our series, Understanding ADHD in Girls, is presented by Dr. Patricia Quinn. Dr. Quinn is a prominent developmental pediatrician with over 30 years' experience in the field of ADHD. For the past decade, she's written several groundbreaking books and presented workshops and lectures across the country, concentrating her focus on girls with ADHD.
In recent years, we've seen a lot of progress in the increased awareness and acceptance of ADHD as a true medical condition. More patients are seeking diagnosis and treatment for the management of their symptoms. Unfortunately, ADHD is still considered by many as a young boy's condition. In general, boys with ADHD tend to be impulsive and hyperactive. Their symptoms are out there for everyone to see. Girls, however, usually have the more inattentive type of ADHD with symptoms that are less disruptive, such as losing things, being easily distracted, or having trouble finishing tasks. As a result, ADHD in girls may be misdiagnosed or missed altogether.
I can never concentrate or stay on task with what my work is. I forget a lot of things.
She would be coming home from school, and I would say, "What's your homework?" And she would say, I would forget. I forgot. I don't know, Mom. I'm trying to do this. I can't remember what the teacher said. She wasn't so much dancing around in her seat as much as she would the focus issue. So the teacher said, "There's something, but we just can't put our finger on it."
Studies indicate more boys than girls are diagnosed with ADHD, which means we could be underdiagnosing girls with the disorder. While girls with ADHD may have fewer learning disabilities and behavioral problems than boys, ADHD is no less severe for girls. Beyond the basic symptoms of forgetfulness, inattention, and disorganization, girls with ADHD have lower self-esteem than boys with the disorder, and they are more likely to have depression and anxiety disorders than girls without ADHD. They're also more likely to have social problems and be rejected by their peers than boys with ADHD.
Peer pressure, not worrying about someone liking her in school, worrying about what friends she was going to be with.
If a girl's ADHD is left undiagnosed and untreated into adolescence, increased academic and social pressures, coupled with emotional changes, may cause them to feel overwhelmed.
If something is due a week from now and she has something due the day before that or something due tomorrow and everything comes together and you can't hash that out, you become anxious.
I went to a counselor about my anxiety and ADHD. Every night she had me writing in a journal about how I would feel anxious, how it related to all different things. After I look back and read that, it shows that it's all because of my ADHD.
The fact is, the stakes are higher when girls with untreated ADHD reach their teens. The risks for family conflicts, repeating grades, drug and alcohol abuse, smoking, depression and anxiety disorders increase dramatically compared to teen girls without ADHD. Parents need to look carefully for signs of ADHD in their daughters because symptoms may not present as clearly as they do in boys. Inattentive girls may look like daydreamers who aren't living up to their potential in school.
I would usually just stare into space a little bit, like think about, daydream about what's really happening, like if I have something to look forward to during the day, like what happened after school, I would pay attention to that, not really focusing on what we're learning.
They may leave projects or chores unfinished and shift from one activity to another. It could be that they're always running late or losing things in a purse or messy locker.
Yeah, I forget a lot of work at home. Like I would do it on my desk, but in the morning, at night, I'd be like, okay, I'll be laying in my bed. Oh, I forgot to put it in my backpack. Okay, I'll do it. I'll put it in the morning. Silly me, I'd forget to put it in the morning. Have to call my mom, have her bring it to me.
Girls with hyperactive type ADHD, while not clearly disruptive, may be extremely talkative, like social butterflies or show-offs. Or they may have fidgety habits or feel restless. The good news is that ADHD in girls is a very treatable disorder. Medications for ADHD are just as safe and effective for girls as they are for boys. And with once-daily medications like Concerta, symptoms can be managed consistently all day, and dosing is done privately and securely at home.
Her doctor prescribed us Concerta. Now with her on it, her grades have gone from C's. She made honor roll the three market credits, probably academic awards this year alone.
I get to pay attention more and be on task when I'm on Concerta. Now I can actually finish a project.
I've treated many girls over the years who have used Concerta, and they've experienced a significant improvement in their ADHD symptoms.
If you're concerned that your child may have ADHD, talk to your doctor about getting a proper diagnosis. Once Daily Concerta has helped many children and teens succeed with ADHD. Ask if it could help make a difference for your child. We invite you to return to Concerta.net to watch future episodes of Lessons in ADHD. Talk to your doctor for a proper diagnosis and treatment of ADHD. Only a doctor can decide whether medication is right for you or your child. Concerta should not be taken by patients with significant anxiety, tension, or agitation, allergies to methylphenidate or other ingredients in Concerta, glaucoma, Tourette's syndrome, tics, or family history of Tourette's syndrome. Abuse of methylphenidate may lead to dependence. Tell your healthcare professional if your child has had problems with alcohol or drugs, has had depression, abnormal thoughts or visions, bipolar disorder, seizures, high blood pressure, or has had any heart problems or defects. If your child develops abnormal thinking or hallucinations, abnormal extreme moods, and/or excessive activity, or if aggressive behavior or hostility develops or worsens while taking Concerta, consult your healthcare professional. The most common adverse events reported in children receiving up to 54 milligrams were headache, upper respiratory tract infection, and abdominal pain. The most common adverse events reported by adolescents receiving up to 72 milligrams were headache, accidental injury, and insomnia.